Knock, knock.
Hi.
Good morning. How you doing?
I'm all right.
My name's Brett, and I'm going to be your nurse today.
Hi.
Yeah, can I get your name and birth date, please?
Annie Potter, 12/31/91.
Okay, and what do you like to be called?
Annie.
Annie? Okay, well, how you doing this morning, Annie?
I'm okay.
What brings you in today?
Well, I'm having left-sided pain on my stomach and kind of around my back. I kind of feel a little cold and feverish.
Feel a little cold, a little feverish?
Mm-hmm.
Okay, I can get you another blanket if you'd like.
That would be nice.
Sure, I'll put that down on this chair. Okay, yeah, I got no problem doing that. Let me get a couple vitals from you. Are you okay with that?
Yep, that's fine.
Okay, so what I'm going to do is I'm going to move your collar here. And I'm going to put a strap on you here. Whoop. Okay, and that's not too tight, is it?
Nope, that's fine.
Okay. Well, that's going. I'm going to set this on your finger, and this is going to take your amount of oxygen that's in your blood,
Okay.
and it's going to do your pulse as well. So we'll actually have two readings.
Okay.
And while all that's going, I'm going to take your temperature if you're okay with that.
Yep, that's
And this I'm just going to run across your forehead, okay?
okay.
Okay, it says you're a little warm, 100.5. So that explains the chills a little bit. Like I said, I can get you a blanket. Okay, and you're at 130/80. That's not too bad. And 99%. And 88's your pulse. So those are looking pretty good. The only thing of a little bit of concern is your temperature. Go ahead and get that out of here. And we'll take that off. Thank you there. Okay, and you said your abdominal hurts. The abdominal area hurts a little bit. Okay, and could you describe the pain at all?
It's just kind of an ache.
Is it kind of just a dull ache?
Mm-hmm.
Okay, and how would you rate your pain on a scale from 0 to 10, 0 being no pain at all and 10 being basically unbearable?
I'd say about a 4.
About a 4. And what's the highest level of pain you think you could tolerate before it becomes too uncomfortable?
Probably a 6.
About
maybe.
a 6. Okay. Okay, and if you don't mind, I'm going to take a quick look. So I'm going to lay your bed down here. We'll lay you back just a little bit. Other than that, are you pretty comfortable? Have you had anything to eat yet today? I don't think you have you?
No, I have not.
Okay, so I'm going to put this down. And I'm just going to pull the sheet down a little bit, okay?
Okay.
And we'll expose your belly. I'm going to lift up your sheet there and lift up your gown. Okay, and there's no scars. It's not red. Doesn't appear to be swollen or anything. And I'm just going to listen, okay?
Okay.
Okay, everything sounds good. I'm just going to feel a little bit, and you let me know if it's tender at all or if there's any pain.
Okay.
So nothing here.
No.
Okay, nothing here.
No.
And then you said there's some left-sided pain, so is that a little bit sore?
That hurts.
Okay, and I won't push real hard either. Does that hurt?
Yeah.
Okay, so I'm going to pull this down. I see in your chart you have a history of a urinary tract infection, and it looks like the last one you reported was about 2 weeks ago.
Mm-hmm.
Okay, any pain when you go to the bathroom now at all?
No.
No, nothing like that?
No.
Okay, and I also see that you have a little bit of a problem with some reflux. That's some acid indigestion when you eat.
Mm-hmm.
And has that been kind of ongoing?
Yeah, that's been going on for a long time.
Okay, and are you taking anything for that? Anything prescription-wise that you haven't told us maybe, or
No, no prescriptions.
just over the counter stuff, like Tums maybe, or
Yes.
something like that?
Mhm.
Okay.
Exactly.
Okay, so no problem right now. Again, you have an 8.
Right.
Okay. Okay. So what I'm going to do is go ahead and sit you back up. Sorry for all the aerobics here. Oh, a squeaky bed, isn't it? Put that back down. So what I'm going to do first is I'm just going to kind of get a look in your mouth. Can you go ahead and say ah and open it? Okay, everything looks good. And is there any tenderness when I feel here at all?
No.
Nope, everything's pretty good.
Mm-hmm.
Okay, so the next thing I'm going to do is listen to your lungs, and all I'm going to have you do is lean forward, and I'm just going to have you take some big deep breaths. So I'm just going to untie. We're going to expose the back of you just a little bit here.
Okay.
Okay. So again, just take some big deep breaths.
All right.
Okay, everything sounds pretty good. I'm just going to feel down the spine a little bit, and you let me know if there's any tenderness. And all I'm looking for is just kind of see if everything's built right. It's getting tender. Okay, I won't push very hard there again either. And everything looks pretty good. Other than the pain, everything looks pretty good. Okay, so go ahead and lay back.
All right.
And now I'm going to listen to your heart, okay?
Okay.
This is painless again. All you got to do is lay there. Okay, I'm just going to go underneath here. I'm just going to grab your hand while I'm doing this.
Okay.
I'm just going to feel for a pulse. Okay, everything sounds pretty good. And while I'm doing that, I'm going to check your IV site. Everything looks good, no infection, it's not red, it's not tender, no swollen. It looks fine there. Can I have you squeeze my hands?
Sure.
Okay, good. And I'm going to check for some blood flow at the fingertips. And all I'm going to do is just squeeze the bed of your fingernails here just a little bit. And everything looks just fine.
Good.
Okay. So what I'm going to do now is I'm going to lift up the bed sheet, and we're going to get a look at the legs and the feet. All right, so let me lift those up a little bit. There you go. So everything looks good here. No tenderness, no swelling. Okay, go ahead and push against me. Okay, and go ahead and pull back. And go ahead and push in and pull out. Okay, Wyatt, I'm going to check for some pulses here. Looks good. And we'll just do some of these. Okay, and that's good too. And just like I did with your fingers, I'm going to squeeze your toes just a little bit here, and we're looking for that blood flow again. Good, everything looks good. So I'm going to go ahead and put your sheet back down for you. There.
Thank you.
Yeah, not a problem. Okay, any other real discomfort to report or anything? Everything's doing pretty good?
No, just that pain on my left side. is
Right,
the
we'll
only
see
thing.
if we can get something taken care of for that. I don't see any water in here. Did they not bring you any this morning?
Not yet.
And you're probably a little thirsty?
Yeah.
Yeah, we
Yeah.
actually would encourage some water with that, so what I can do is I'll bring you a blanket and I'll go get you some water as well.
Okay.
Okay? So, I'm going to go ahead and put this back up. And we're going to lower the bed back to its correct height here. Yeah. Are you okay sitting up?
Yep, I'm just fine.
Sure. I'm going to give you your call light, and any time you need me, you go ahead and push that, and I'll come in and see you. do now is I'll go get that water, and I'll go get that extra blanket for you.
Okay, thank you.
Yeah, sure. You go ahead and ring if you need anything. Again, my name's Brett.
Thanks.
Yeah. My patient Annie is a 22-year-old female admitted at 06 this morning with a diagnosis of pyelonephritis. Patient complains of abdominal pain, fatigues, chills, and left-sided flank pain. Patient has a history of UTI with the last occurrence of about 2 weeks ago, and she suffers from congenital reflux, which she takes over-the-counter antacids for. Patient is alert and orientated ×3. Upon palpation of the left side of the abdomen, she complains of pain and tenderness as well as in the lower back region on the left side. Patient denies any pain on urination. Patient rates the pain at a 4 and claims that she doesn't want it to be any higher than a 6. I recommend the patient start oral pain meds now so they have time to kick in and be effective before the pain gets out of control. And I recommend a healthy increase in oral